Do you ever have trouble focusing at work? In today's Long Island Naturally, our Mary Musey says, try to train your brain in the new year.
Just 7 months working with the Wellness Center. I'm on no medication, and that's going from a place of being very, very sick.
Denny Loza came looking for relief from her anxiety and migraines, but she found that and more.
It's been very helpful with alleviating the chronic pain from the lupus.
This is no computer game. Instead of a keyboard, electrodes placed on Denny's scalp allow her brainwaves to control what she sees. The treatment is called BrainCore, and Dr. Jason Pape says it improves a patient's ability to ease into brainwave patterns that allow us to focus, be creative, relax, or sleep.
The brain starts to learn to use those pathways more, and it lays down new pathways and makes better connections.
Dr. Pape says BrainCore can help with all kinds of neurological problems. That's because it actually teaches the brain to function more efficiently.
So I like to say we take a dirt road and we turn it into a superhighway.
Increased concentration, attention span. I felt organized, focused.
Jessica Basilico used to control her ADD with medication. Now, thanks to BrainCore, she's conquered her focus issues without drugs and their side effects.
I'm just a happier person, feeling like I'm not stressed out and running around with my head cut off.
Treatment is no quick fix. Tammy Topol has taken her autistic son Brandon for 20 sessions so far.
Now I'll, say, Brandon, what are you doing? And he'll tell me, which is new.
At the Wellness Center in Northport, I'm Mary Musey, News 12 Long Island.
What a concept. Mary has more about BrainCore on her blog, and this weekend, the half-hour show of Long Island Naturally.
Brainwaves are a window to the brain. They tell us how different areas of the brain are communicating. Each of the 5 different brainwaves are associated with a particular state of mind. For example, when your brain is externally focused and alert, the brain is producing beta waves. When your brain is calm and relaxed, it's producing alpha waves. The electroencephalogram, or EEG, is a non-invasive diagnostic tool that allows us to measure the different brainwaves. As such, it provides a window to the brain and how well it is functioning. The EEG provides information regarding the dysregulation of brainwaves, a condition known as neurological dysregulation. Neurological dysregulation refers to the inability of the brain to regulate itself. This results in miscommunication within the brain and the production of abnormal or atypical brainwave patterns. This condition may be caused by poor nutrition, emotional or physical trauma or stress, drugs and toxins, or a subluxated spine. Neurological dysregulation is associated with ADHD, migraine and tension headache, insomnia, fibromyalgia and chronic pain, as well as many others. It has also been shown to be a factor in Parkinson's, autism, and Asperger's syndromes. Delta waves are considered to be the slowest wave in the frequency range of 1 to 4 Hz. These waves are produced during stages of deep sleep and are associated with the production of human growth hormone, which is necessary for growth, healing, and tissue repair. If a person's brain is unable to produce delta waves, then a deficiency of human growth hormone may result. This can lead to conditions such as fibromyalgia, tension headache, migraine headache, insomnia, and chronic pain. Theta waves are associated with a twilight state of mind. These waves are produced when your brain is falling asleep. They're associated with memory retrieval and creativity. However, when they are produced at inappropriate times, such as when a child is trying to concentrate in class, these waves may be associated with inattention and lack of focus. Over 25 different research studies have demonstrated that children and adults with ADHD produce unusually high levels of this wave. It has been suggested that measuring theta wave levels is the most accurate method for diagnosing ADHD. Alpha waves are also known as the meditative brain wave. This is because when a person meditates, the brain waves shift to alpha. Alpha is associated with relaxation, calmness, and a sense of well-being. Alpha is also associated with the ability of the brain to enter deep sleep. If a person's brain produces unusually low levels of alpha, then it will be impossible to enter delta sleep, a disorder known as insomnia. This finding has also been linked to conditions such as hyperactivity, migraine headache, tension headache, and fibromyalgia. SMR waves are the brain waves that are produced when a person is completely still and focused on one particular task. The Olympic high diver standing atop his diving board just before the dive, or the golfer standing perfectly still just before his swing, are just two examples of when the brain is producing SMR waves. The ability of the brain to produce high levels of SMR has been linked to decreased hyperactivity and an increased resistance to seizures. Several studies have shown that increasing levels of SMR may reduce grand mal seizures in epileptics by 70%. Beta waves are considered to be the fastest brain wave. The brain produces beta waves when the individual is alert and externally focused. Established research studies have demonstrated that children and adults suffering from ADHD produce unusually low levels of beta waves. This finding may help explain why these patients are unable to stay focused on certain tasks. On the other hand, if the brain produces too many of these beta waves, the individual may become hyperactive and anxious.
Do you have any idea who I am?
I've never even met you.
Squirrel!
All I do is dream of you the whole night through. With the dawn, I still go on.
I just hope I could stay awake.
Can I get you a cot or something?
Nope, I've got the caffeine patch. It's my invention. Each patch is the equivalent of 12 cups of coffee. You can stay awake for days with no side effects. Ah! Sorry.
Everyone will tell you to let it go and move on, but don't. Instead, let it fester and boil inside of you.
All we need now is an equally magnificent brain.
Back when I was in second grade, I had a teacher who constantly yelled at me, and I was always getting in trouble for fooling around, talking, not paying attention, fiddling with things under my desk. And she kept complaining to my mom. My mom took me to the doctor, and they told me I had ADD. They put me on different medications. I've been on about 5 medications, and then about 6th grade, I went on something called Adderall to help me focus better, and it helped, but It was giving me twitches and tics. I mean, I hated zoning out. I hated sitting there in class and not knowing what was going on or being able to remember it 5 minutes later after the teacher said it. And my mom would always try and have conversations with teachers and just get everything fixed, but it always led back to medicine. They got me on BrainCore, and I started noticing like I was focusing better. I could understand what people were saying, and I could remember it later rather than just in one ear and out the other. After about 7 or 8 sessions of BrainCore, I started noticing like more and more improvement, and then every week after that it was getting better. I'm noticing that I can do everything on my own rather than relying on the pills. BrainCore is an extremely easy treatment, but it is very effective.
I used to really suffer with insomnia. I would go to sleep for maybe an hour, wake up and be up for 3 or 4 hours, sometimes 5 hours. Couldn't go back to sleep, walk around the house, and it was really, really debilitating. Every chance I get, I talk about BrainCore because it's changed my life. It makes you normal. You know, after thinking that you're abnormal for a long, long time, it makes you realize that it wasn't you per se. Your brain just took a little trip the wrong way, and BrainCore brought my brain back, and I'm really happy about that. And I feel really energized when I wake up in the morning. I'm not tired, I'm not sluggish, I don't feel like I need a nap in the afternoon like I did every day for the last probably 20 years. And it's been great, it's really been great.
Ever since I was a little boy, I had severe panic issues, which many people have and many people just take medication for. I refused to be a medicated human being, so I dealt with them as best I could, and they started to get to the point where I couldn't deal with them. Wanted to basically jump off a bridge. Was seriously about to lose it. You kind of wonder if you're crazy, and then fear sets in, so it gets worse, and then such and such, and it's a downward spiral, and you just pray for it to stop. Panic attacks started happening at work, and I would be addressing a customer, somebody who I know very well, and all of a sudden it happens. I'm in the bathroom on my knees, scared to death, cold water, the whole nine, you know, panic attack, freaking out. About 7 treatments in, which is about 3 weeks, I was driving to work, and all of a sudden I realized I didn't have a panic attack the day before, the whole day. Before BrainCore, I basically lived in hell, and now, you know, life is what it's supposed to be, you know, carefree and wonderful. BrainCore therapy is a miracle. It's awesome.
When my son was 7, he was diagnosed with ADHD. His problem began in kindergarten. He had a teacher that was constantly getting on to him. He was getting up, disturbing the class, talking quite a bit. But then, you know, as time went on, it seemed to get worse. At home, his dad and I we were able to kind of deal with the situation. But as each grade came on, the teachers could not deal with him. We did put him on medication. It was something that we fought for 2 years because we just really didn't want him on medication. But then when the school starts calling, and they call 2 and 3 times a week, what do? I mean, you're kind of stuck in a corner. We've got to do something to help this kid. But with taking the medication, there were all the side effects that come with the medication. And our son happened to be one of those kids that got severe side effects. One of the worst ones that he has is the weight loss. Like now, he's 12 years old, and up until 12 weeks ago, he weighed 68 pounds. And that was pretty disturbing to his dad and I. He had no tics prior to medication, and he developed tics. You know, the jerking of the head, the moving of the arms. For us, BrainCore therapy is something that I definitely would recommend to any parent that's going through the things that we have gone through with a child that has ADHD. The change in our son in the past 12 weeks has been tremendous. Like I said, he's happier, his self-esteem is up, his behavior at home has gotten better, his behavior at school has improved. And just all around, it's just been a wonderful feeling knowing that this kid is doing so much better. With BrainCore, we've taken him off the medication, and he's still on the honor roll. He wasn't able to do that before.